Hello, and welcome to Healthy Care. Today, we're diving into fifth disease, a common viral infection in children. If you've heard of the slapped cheek rash but aren't sure what it means, this video is for you. We'll explain what fifth disease is, its symptoms, causes, transmission, and how you can prevent and manage it. So, stay with us till the end to get all the details you need to know. 1. What is fifth disease? Fifth disease, also known as Erythema infectiosum, is a viral infection that mostly affects school-age children. It's called fifth disease because, historically, it was the fifth recognized illness that caused rashes in children. The other illnesses include rubella, measles, scarlet fever, chickenpox, and roseola infantum. This disease is most common during late winter, spring, and early summer, and about 50% of adults are already immune, likely because they had the virus during childhood, often without realizing it. Key takeaway: fifth disease is generally mild and self-limiting but contagious, spreading easily among young children. 2. Symptoms of fifth disease. At first, the symptoms of fifth disease might seem like a common cold. You may notice mild fever, stuffy or runny nose, headache. However, within 7 to 10 days, a distinctive bright red rash typically appears, first on the cheeks, often referred to as the slapped cheek rash. This is the hallmark of fifth disease and the most recognizable symptom. But not all children will get the rash. Additional symptoms may include a red rash that spreads to the arms and legs, often lasting anywhere from 2 to 39 days. It may itch and fade in a lace-like pattern. Joint pain and swollen glands. Red eyes or a sore throat in some cases. In adults, the rash is uncommon, but they may experience flu-like symptoms, such as joint pain in the hands, wrists, knees, and ankles. Key takeaway: the slapped cheek rash is the key identifier of fifth disease, but symptoms can vary, especially in adults. 3. Causes and transmission of fifth disease. Fifth disease is caused by the parvovirus B19, which only infects humans. It spreads through respiratory droplets when an infected person coughs or sneezes. Direct contact with infected blood. It's important to note that by the time the rash appears, children are usually no longer contagious. The incubation period for fifth disease is between 4 and 14 days after exposure, although it can be as long as 21 days. Children attending daycare or school can continue attending once the rash appears, as they are no longer likely to spread the virus. Key takeaway: fifth disease is most contagious before symptoms fully appear, so early detection can be difficult. 4. Prevention of fifth disease. There is no vaccine to prevent fifth disease, but there are steps you can take to reduce the risk of spreading it. Wash hands frequently, especially after blowing noses or before preparing food. Avoid sharing food, drinking cups, and utensils. Disinfect toys and other items children frequently put in their mouths. Encourage children to cough or sneeze into their elbows rather than their hands. Play outdoors whenever possible, as viruses spread more easily in enclosed spaces. Key takeaway: simple hygiene habits, like hand washing and avoiding shared items, can help prevent the spread of fifth disease. 5. Diagnosis and treatment of fifth disease. Fifth disease is usually diagnosed based on its distinctive symptoms, particularly the slapped cheek rash. However, in certain cases, a blood test can confirm the presence of parvovirus B19. While there's no specific treatment for the virus itself, you can manage symptoms with acetaminophen for fever, ibuprofen for joint or muscle pain, antihistamines to relieve itchy rashes. For those with weakened immune systems or chronic conditions like sickle cell anemia, immunoglobulin therapy or blood transfusions may be necessary. Key takeaway: there is no cure for fifth disease, but symptoms can be managed with over-the-counter medications. 6. Risks for pregnant women and complications. While fifth disease is generally mild, it can pose risks for pregnant women. If a woman contracts fifth disease during pregnancy and is not immune, the virus can potentially cause severe anemia in the fetus, leading to complications such as heart failure and, in rare cases, miscarriage. Pregnant women who have been exposed to the virus should consult their doctor immediately. A blood test can check for immunity, and if the virus is present, careful monitoring with ultrasounds can detect any complications in the baby. Key takeaway: pregnant women should take extra precautions to avoid exposure to fifth disease, as it can rarely cause complications for the unborn child. Thanks for watching this episode of Healthy Care. Don't forget to like, share, and subscribe for more health tips and medical insights. Stay healthy, stay informed, and we'll see you in the next video.